Good day, everyone. My name is Chadley Yasrin, and I am from Group 12, together with Samuel Penales from Bachelor of Secondary Education, major in Science, Section 128. And our topic will be all about multiple disabilities. And I am tasked to discuss to you about the definition of multiple disabilities, types of multiple disabilities, and educational challenges regarding it, and also about the treatments of multiple disabilities. First, let's talk about the definition of multiple disabilities. When you hear a word multiple disabilities, what comes first in your mind? Okay, so multiple disabilities is a broad umbrella term which simply means that the children or student has more than one disabilities. Therefore, specifics of this diagnosis are almost endlessly variable, and great care needs to be taken to adjust the needs of the students. Individual educational support to their particular needs. And now let's talk about the types of multiple disabilities. And these are some of the types of the multiple disabilities. First, deaf, blind, visual impairment plus hearing impairment. Second, visual impairment plus hearing impairment plus mental retardation. Also, visual impairment plus mental retardation, and also cerebral palsy plus mental retardation, and also hearing or speech or visual problems. So now, what is deaf blindness? Deaf blindness is a combination of sight and hearing loss that affects a person's ability to communicate, access information, and get around. It's also sometimes called the dual sensory loss or multisensory impairment. Number 2, visual impairment. So what is visual impairment? It is defined as a visual acuity less than 20/40 in the better eye, while hearing impairment is defined as the pure tone average air conduction hearing threshold worse than 25 to dB hearing level in the better ear, wherein it is average over frequencies 500, 1000, 2000, and even 4000 Hz. So, what is mental retardation? On the other hand, mental retardation as well is a permanent condition characterized by sub-average intelligence, which causes limitations in learning and adaptive functioning. Now, let's talk about cerebral palsy. This is known as a group of disorders which affects a person's ability to move and have a maintained balance and posture. CP is the most common motor disability in childhood, as what I have also observed. Also, cerebral means having to do with the brain. And on the other hand, palsy means weakness of or problems with using the muscles. Understood? Now that we're done about the definition and types of multiple disabilities, now let's move forward to the educational challenges. So, the educational challenges in the multiple disabilities is finding a setting that is suitable to the child's intelligence level. Also, a child's ability to effectively communicate with teachers, support staff, and peers. And also, a student's capability to function in the classroom. And lastly, assessing and compensating for visual or hearing impairments. And now let's talk about the treatments of multiple disabilities. Let's start with the number one. Preserve and maximize anything that is remain sight or hearing the person has. This could involve treating underlying conditions like cataracts, wherein wearing glasses or using a hearing aid. Teach alternative methods of communication such as hand-on-hand signing or braille. Number two, what is the treatment for vision impairment? So, options may include eyeglasses, contact lenses, and eye drops or other medicines. In some cases, surgery may be required. For instance, cataracts are often treated by removing the clouded lens and replacing it with an intraocular lens, or what we call an artificial plastic lens that requires no special care and restores vision. Number 3, hearing impairment, wherein options include removing wax blockage. Earwax blockage is a reversible cause of hearing loss. And also, others can also suggest surgical procedures. And some types of hearing loss can be treated with surgery, including abnormalities of the eardrum or bones of hearing, or what we call ossicles. And number 4, the treatment of mental retardation is predominantly non-medical, which involves education to achieve maximal learning potential, habilitation, vocational training, and normalization of social and recreational activities. On the other hand, most children and adults do not have medically identifiable causes for their mental retardation. And now, from the last part, which is the treatments for cerebral palsy. So, braces, splints, or other supportive devices might be recommended for your children to help with functions such as improved walking and stretching stiff muscles. Also, you can try the occupational therapy, where an occupational therapist work to help your child gain independence in daily activities, and also routines at home and school and in the community. And that would be all for my topic, and the other topic will be discussed by Samuel Canales. Thank you so much for listening.